over here at the triage station. When patients come in, they'll pass through here and we'll figure out how critical they are and determine actually where in the unit they go.
This is the isolation tent. We have capacity for 2 beds if needed, and patient is contained in here if we are suspecting any infectious disease that would require contact droplet or airborne precautions.
I am here in our internal waiting area. This is where the patients will wait after they have been triaged. We can do some basic workup here. I will take weights for the children. I will do active checks for those who need them. I will also coordinate with our consultation nurse to get the patients that need our other basic lab work done.
This here is the sterilization area. This is where the clinical team interfaces and works with the wash team. All these instruments will be cleaned by the wash team and dried here in the drying rack. After the instrumentation is dry, this is where the clinical team takes over. We inspect the instrumentation, we disinfect it, we package all the instruments to then be sterilized within our autoclave. Coming from the autoclave, we then take these same packages and put it in our sterilization box that we will manage and make sure that we can disseminate appropriately to the facility as needed.
We're standing here in the reproductive health area. We screen all females for any reproductive health needs. We take care of pre and postnatal women, also screen and care for SBGV survivors.
Hello, this is the med communication area. So, for instance, when we need to transfer a patient, I would be sitting here on the radio or on the phone with the EMT arranging the facility the patient would go to and planning with logistics and security, perhaps the med coordinator about getting the patient out safely, discussing with the team, discussing if our staff needs to travel with the patient.
Right now we are in the sort of the consultation wing of the EMT. And this is where we're seeing sort of the bulk of our patients. We have 6 consultation rooms here. Over here we have A and B. These are our horizontal rooms where patients that are triaged to ESI levels 2 and 3 will be. So patients with chest pain, dizziness, abdominal pain, where they can sort of lay in a bed. Over here we have consultation room C, which is our quote-unquote casting room. This is where we're going to take care of simple fractures and splinting with plaster. Consultation room D, or dirty, this is where we do minor surgical procedures such as laceration repairs, wound care, incision and drainage, abscesses. Is our ears, eyes, nose, and throat room. And then in F here we have our fast track room, which is basically things are going to be really quick, so we can sort of get patients moving in and out. That's like medication refills or other sort of simple things, sore throats, that kind of thing.
So this is our lab. Patients are ordered for labs either in intake and triage or in consultation rooms by providers. They come back here to get their labs. They're always being escorted by a nurse or sometimes a community health worker. And the labs that we have available here, all point of care testing. So we have hemoglobin, glucose, we have urinalysis, which is done outside of the building. We have pregnancy, and we have malaria.
And this is in the pharmacy, which is the last step for the patients. They'll come in with their records, we'll check those, we'll dispense any medications that they need, and then counsel them on the use of the medications as well.
On behalf of the EMT Secretariat, on behalf of the EMT Initiative, on behalf of the network, the partners, and most especially the patients, thank you very much for all the hard work done, and we'll see you around. Congratulations. Very well deserved.